If health insurance is the reason you're not freelancing or working for yourself yet, I get that. Health insurance is a complicated, super annoying topic that seems very important to good living of life, a good life, but for some reason we aren't really taught anything about it in school. And I know it's a topic that often prevents would-be amazing freelancers from making the career change that you want to. The great news is there are plenty of great health insurance options out there, so we pulled up our sleeves. I already pulled up my sleeves, and we did the research for you, so let me give you the full lowdown and all the health insurance options for freelancers in this video today so you can finally cross-figure out health insurance off your list. First note, I'm separating this video into sections for my US peeps and then non-US specific ones, so it's super clear which ones may apply to you in your country. I'll also leave links to everything I mentioned plus sources below. And second note, we are not healthcare professionals. We do not know what's best for you and your health situation, so please consult a professional for that. We've just done our research and gathered up all the options for you for easy access. Hey, my name is Dea, freelancer, digital business manager, and most recently, entrepreneur. And as always, you can find sections on the play bar below if you want to skip to a certain part of the video. Your time is precious, so take what you need. And if you want to watch this on 2x, I will not be offended in the least. Okay, let's dive into the video. Before we fully dive in, here are two health insurance related terms that I did not understand for a very, very long time. So just to clarify as we dive into this, the first word is the word premium. So this is the amount you pay every month for your health insurance to have access to it. AKA if you pay $200 a month for health insurance, that is your premium, the $200. Deductibles, on the other hand, this is how much you will have to pay yourself out of your own wallet, out of your own pocket, before your health insurance will begin to cover it. So as an example, if you choose to have a $1,000 deductible on your health insurance plan, you will have to pay that first $1,000 yourself a year for any medical bills before your health insurance will begin to pay, basically. This is interesting because you can opt for a higher deductible on your plan to get a lower monthly premium if you would like to do that trade-off, essentially. Now, here are two questions to ask yourself as you dive into doing health insurance research. 1, how much coverage do you want? How extensive do you want your health insurance plan to be? 2, will you be traveling at all? Because I know this audience, a lot of people are probably interested in traveling part-time or full-time, or will you mostly be stationary? If you will be traveling, you may want to consider something like global health insurance like we did when we were traveling full-time. I'll talk about that later in this video. So there's two questions just to keep in mind as we dive into all of this. Okay, now let's officially dive in. Let's start with the country where it is probably the hardest to find an affordable option for health insurance. In the US, it is a great idea to explore all your options before you choose a plan that is specifically right for you. According to the World Population Review, we did the research, the US spends the most on healthcare per person per year, and this can then translate into pricey healthcare for individuals to the tune of $3,200 per person. Now, the good news is, even though American health insurance is expensive, you may qualify for a better plan or lower premiums than you would with a traditional employer. It kind of depends on your situation. This is because most company group plans don't reflect the very different needs of individuals and families, so being self-employed allows you to choose the exact type and amount of coverage that makes sense for you, and that could end up saving you money big time. Now, because health insurance varies by state, it would be wise to do your own individualized research, of course, but here are a few broad options. All right, first option is there are a few age-specific laws in the US. So if you are under 26 years old, congratulations for being young. But also, since 2010, under the Affordable Care Act, you can now stay on your parents' plan until your 26th birthday. On the other hand, if you are over 65, you qualify for Medicare, and a large portion of your health costs are covered by the government too. The second option is health insurance marketplace. So the ACA is a viable option for some freelancers or businesses. Plans are divided into 4 categories: bronze, silver, gold, and platinum, with each varying on quality and coverage. Depending on your family size, your income, you may qualify for lower rates. Most freelancers qualify as low income when they're just getting started because you're just building your client base. In the US, you can qualify you for lower health insurance premiums. I'll link a nifty health insurance premium and subsidy calculator below to help you get an estimate of your unique health insurance coverage. Option 3 is COBRA. If you're considering quitting a job where you have health insurance, you may be able to benefit from COBRA, or the Consolidated Omnibus Budget Reconciliation Act, a government rule from 1986 that offers former employees the right to extend their coverage, typically for up to 36 months, by taking over their premium payments. This could be a super beneficial option for those of you who are leaving traditional jobs to test out freelancing or start freelancing as a temporary solution while you sort out your options and grow your business and your client base. Option 4 is the Freelancers Union. Super cool option. Check them out. I'll link them below. They offer health insurance plans for self-employed people in a bunch of states, including New York, California, Florida, Texas. Their mission mission is to secure a better future for the self-employed in America. I love this. I feel like more things like the Freelancers Union are going to pop up in the coming years. They're free to join and worth checking out. With over 56 million Americans doing some kind of freelancing last year, hopefully this type of insurance group will become more and more popular. Option 5 is to sock away before you quit your job. So this tip won't apply to everyone because let's face it, it can be really hard to save money sometimes, but if you can swing it, it is a great idea to have some money put aside before you leave your company plan. Because the deductibles on lower costing plans can be very high, it is a great idea to put away an amount equal to or greater than your deductible in a high yield saving account before you leave your job and hopefully not have to use it. But then it doubles as an emergency fund, which is super important when you're starting out as a freelancer as well. For example, if you choose a $300 a month plan but have the $10,000 deductible set aside just in case. My friends over at Virtual Assistant Internship also wrote an awesome blog post on this with a few more options like statewide program and free clinics, local hospital insurance, health co-ops like Medishare, and more. I'll link that blog post below if you're after even more options just to weigh everything. Alright, so now let's talk about non-US specific health insurance options for freelancers. Now, just for context, I'm not American. I have never lived in the US. I know the American accent trips a lot of people up. I've almost always been covered by public health insurance where the amount that I paid per month depended on where I lived and my income level. So in Germany, it's actually crazy high to pay for public health insurance as a freelancer yourself. Yeah, I could talk for 2 hours about that, but we don't have that time. The only time we weren't on public health insurance was when we were traveling full time. So we had global private health insurance at that point, which is what worked best for the amount of places we wanted to visit. So from my experience, our global private health insurance was super amazing. It was with Now Health. I think we paid around 200 to 300 euros a month. But anyway, a lot of countries have universal healthcare coverage. That's mostly what you will end up paying into. This means a mix of single payer, socialized, and privatized care, but with one main similarity. So everyone is included and contributes. This ensures that the healthy people help offset the cost of sick people. And in Europe, health insurance plans vary by country, but most have some type of universal healthcare. I can't go into every country's particular system, but option 2 that I'll mention in a bit will be super helpful for getting started and getting something customized to you and your needs, which is the most important thing. So option 1 is you may qualify for insurance through some professional organization, like your city's Chamber of Commerce. These are geared towards small to medium-sized businesses and allow you to match your needs with your company's budget. So that's a great thing to check out. By pooling resources among business owners, these plans allow small businesses to access coverage that used to only be available to large corporations. So definitely check that out. You can just type it into Google, your city, and then Chamber of Commerce, and then just read through the website. So option 2 is to use a health insurance broker. To help you find the best coverage for your unique situation, you could consider bringing in a health insurance broker. So a health insurance broker is a licensed benefits professional who help individuals and businesses navigate the health insurance selection process from start to finish. I honestly did not know this was a thing. I was so stressed out for such a long time because I did not know this was a thing. But we used the broker Pacific Prime to find our global health insurance that I mentioned called Now Health when we were traveling, and the experience was amazing. I will link them below. I'm not affiliated, not sponsored, nothing. I just really liked using them. The consultations were completely free. Now, I assume on their end they get a kickback when we select a provider through them, but our contact was super helpful, found us lots of options very specific to our situation, where we wanted to travel, how much coverage we wanted, deductibles, our citizenship, all of that stuff. And they really helped us secure the health insurance, first of all, and make that process easy and not overwhelming. And they offered us help after as well with any claims that we could go to them with any issues. So this is, in my experience, the best option for anyone who feels super overwhelmed by the process of researching, selecting your own coverage, which I assume is most of us. They will go through all your options with you and tailor you a plan to fit your unique situation and budget. So yeah, definitely check them out. I'll link them below. Now, this is just a final quick option. If you have a spouse or domestic partner with a traditional job that provides benefits, you can sign up to receive benefits under their plan. Easy and effective. It is good to remember, however, that not everyone has access to this option, but I included this option because if it does apply to you, it is the easiest and most option to get great coverage. So being self-employed can actually be advantageous in some situations when it comes to health insurance. Employer-provided plans tend to be one size fits all, while individual plans allow you to choose the exact type and amount of coverage that makes sense for you. So hopefully that's shed some light on what can be a very complicated and annoying topic to deal with. If you are currently working as a freelancer already and have found a health insurance solution, so fancy, you like, let us know in the share and comment circle below so we can all benefit. As I mentioned, you'll find links to everything below. As always, thanks for watching, and I'll catch you in the next one. Okay, bye!